Maybe you've seen a headline like this recently, about the 20% of people who've started resorting to home dentistry, including some who are pulling their own teeth. But if none of those people are in your household, you might have shrugged and put it down to the pandemic. After all, NHS dentists were forced to stop working for months, and that created quite a backlog. That's true as far as it goes, but, actually, large numbers of people were already having trouble accessing dental care before the pandemic hit. According to analysis from the British Dental Association in 2019, 4 million adults went without the care they needed over the previous 2 years. 1.3 million of those tried and failed to get an appointment, 2 million didn't bother trying because they didn't think that they could get an appointment, 130,000 were stuck on waiting lists, and 700,000 couldn't afford it. Just to be clear, most of that last group, the 700,000 who couldn't afford treatment, are largely working people, because those on universal credit with incomes below £435 are entitled to free care, as are pregnant people, nursing parents, and a few other groups. But what about the 2 million who didn't bother to try to get an appointment? You might be thinking that it's their own fault for being too lazy or defeatist. To respond, let me ask you a question about haircuts, because that's another one of life's necessities for most people, another service that should be easily accessible. What sort of experience would you need to have in order to form the belief that you couldn't get an appointment for a haircut if you tried? How many hours would you have to spend ringing around hair salons, pleading with receptionists to squeeze you in, before you gave up and admitted defeat? Obviously, that's a ridiculous question, because long hair is glorious. Princess chic, baby. But it's also ridiculous to imagine being unable to access an essential service when we live in a wealthy country. So, what's going on? For a start, the UK had only 53 dentists per 100,000 citizens in 2019, already one of the lowest rates in Europe, and today that figure stands at only 39.9 for England. To put that in perspective, Estonia has 98 dentists per 100,000 citizens, Lithuania has 95, the Czech Republic and Hungary have 73, Slovenia has 72, and Latvia 71. Unless Estonians are living in a strange movie, where women have an extra set of teeth in their you-know-where, it's safe to say that Estonia doesn't need 2.5 times as many dentists as England. In other words, England is woefully understaffed. Both of these problems, the shortfall of dentists and the prohibitive costs of NHS dentistry, have their roots in the years following the creation of the NHS, although they have been deliberately worsened by the government over the last decade. When the NHS was first rolled out, free dental care was a big deal. 3/4 of adults over 18 had at least one missing tooth, and other oral health problems, like gum disease, were rampant. At the same time, most people were poor. Britain hadn't long come out of the Second World War, and even before the war, normal working people couldn't afford good health care. When the government announced that everyone would be entitled to free dental care, many people stopped going to the dentist, choosing instead to wait 2 years for the rollout of NHS services. The government hadn't anticipated this backlog of demand, and it caused a budgetary crisis. In response, ministers made 2 decisions that would shape government policy to this day. First, they cut dentists' pay 3 times within 2 years, and second, they started charging patients for NHS care. These 2 policies, of trying to pay dentists the absolute minimum, while shifting the cost onto patients, never went away. Only now, it's become so extreme that both dentists and patients are being pushed to breaking point. Over the past year, 8% of NHS dentists in England and Wales have quit, either switching to private practice or leaving the profession. When you ask dentists why they're quitting, they're clear about their reasons. "I am overstretched and underfunded," one dentist told ITV News. "It's exhausting. It's awful having to make a decision that I never thought I'd have to make. I feel guilty, I don't want to do it, but I can't carry on the way that it is. To save NHS dentistry, you need to listen to what we're saying. Otherwise it's not going to exist and more patients will suffer as a result of it." The problems caused by charging poor patients for treatment aren't new either. Between 2014-15 and 2018-19, the government increased patient charges by 9% in real terms, while also cutting funding for NHS dentistry by 4%. During this period, the number of NHS dental visits decreased by 26.5%. Isn't that a strange coincidence? The huge number of people suddenly unable to afford care caused an outcry that led to a wave of angry newspaper articles. As a result, the Tories froze the price of NHS dental treatment. Then, 6 months later, after the fuss had died down, they raised patient charges by another 5%. And that brings us back to where we started, with 20% of Brits resorting to home dentistry, and some people who are now desperate enough to pull their own teeth out in the 6th richest country in the world. But what can we do? Actually, this problem is a simple one to solve. All we need to do is offer dentists a contract that allows them to make a living, allow them to treat as many people as need treatment, and eliminate or reduce patient charges. Oral health has improved tremendously since the early 50s. Fluorinated toothpaste and mouthwash are staples in almost every bathroom, and people are well educated about good oral hygiene. In its first 2 years, NHS dentists extracted 33 million teeth and provided millions of dentures, but demand today isn't nearly as high. And if we allow dentists to provide preventative care, which they haven't been able to do adequately on the NHS for a long time, that would eliminate much of the need for expensive treatments altogether. The austerity policy of cutting ever more funding for treatment, and placing the burden of payment on people at the point of service, isn't working. All it's doing is creating a two-tier system, where some people are denied necessary healthcare. Ultimately, this is a story of the Conservative government denying poor people access to treatment, while at the same time cutting tax for corporations. You pay your national insurance, and then you pay again for your own teeth and glasses. Those who can't afford to pay twice get nothing, even when they're technically entitled. This is all part of the plan to transition the UK into a private healthcare system. First they underfund the service, then they say that the system is broken and needs to be fully privatised, in order to improve the quality. The Tories did it with our rail service, and now they're doing it with our health services. Unfortunately, the plan is working. As dentists leave the NHS, they're taking the better off patients into the private sector with them. The only way we can stop this process dead in its tracks is if we build a mass movement, and fight to keep our public services public, including NHS dentistry. If you want to get involved in the fight, there are steps you can take. If you can spare some time or money, then you can look up some of the organizations on screen. And if you're nervous about getting involved in activism, then why not sign up to their mailing lists to get a feel for what they do, before you decide whether or not to get involved? NHS dentistry and the rest of our public services belong to all of us, and we're going to have to fight for them if we want to keep them. None of us can do it alone, but together we have a chance.